Hi, welcome to our next session in the Pathfinders Academy from the Department of Health and Human Performance. This session will cover the Bachelor of Science in Health. My name is Dr. Christopher Lettingham. I'm a professor of health education, in addition to many other titles here at UTRGV. But today I'm excited to talk to you about our Bachelor of Science in Health program here in HHP. Now, in this session, I'm going to cover a little bit about the profession, what health education is. I'm going to give you a program overview, talk about some entrance requirements, and I'm going to reference our roadmaps, but I'm not going to show you an example just yet. So get ready for something interesting. Now, the mission of the department is straightforward. We have a focus on preparing exercise science, kinesiology, and health majors to function professionally in a changing and diverse society to improve the quality of life through the understanding, delivering, and promotion of health, physical activity, and wellness. And with all that in mind, let's talk about health. Now, a bachelor's degree in health will train whoever signs up for that degree to become a health education specialist. But the question is, what is a health education specialist? An health education specialist is someone who teaches behaviors that promote wellness. They develop and implement strategies to improve the health of individuals and communities, and they offer knowledge, skills, and training that complements the work of many others. Healthcare teams are made up of doctors and nurses and PAs and pharmacists and social workers and health education specialists. We work with healthcare providers, policymakers, human resource personnel. Health education specialists work in a lot of different areas. What do we do? Well, we assess the needs of people and communities. We know how to get out and really help determine what a community needs. Sometimes that's different than what they want, but we know how to do needs assessments. We train our students to develop programs, materials, and events to teach people about health topics or manage health conditions. We are a pretty broad career field. We know how to evaluate, and we teach our students how to evaluate the effectiveness of programs and educational materials. Have you ever seen something on a billboard and just like, who designed that? Well, might have been a marketing person, or it might have been a health educator or a health education specialist, as we prefer to be called. We help people find health services and information. We provide training programs for other professionals and community health workers. We advocate for improved health resources, policies, procedures, and services that promote health. We collect and analyze data to learn about a particular community to improve programs and services. And you're like, well, isn't that needs assessment? That's part of it, but sometimes that's all we do. And we supervise staff who implement health education programs. We work with a lot of different people. Where do we work? Healthcare facilities, hospitals, clinics, state, county, local public health departments, schools and universities, federal government, nonprofit organizations, business and industry. You ever sign up for your worksite health plan at your school? Well, that's usually put together by a health educator or is influenced by a health education specialist. So we work all over the place. And when we look at our situation right now, health education specialist employment is expected to grow by more than 12%. Now, this was data from 2014 through 2024, but given our current crisis, the need could go up. Now, starting out, a health education specialist, on average, has a starting salary of around $45,000 a year, depending on where they work. Now, with some nonprofit organizations, the pay rate's a little bit lower. With some local health departments, the pay rate may be lower, but people can advance through the program if they continue their training, perhaps go on to get a master's degree. But on average, 45,000 is our starting point. Now, why is health education important? Why do we have to have this degree in health to train health education specialists? Because health education is a process that improves the health of people, families, and communities. And now you're thinking, well, doctors do that. Not really. Doctors give a prescription, they may give a presentation here or there, but to have the health educators, the public health folks who are really on the front lines working to improve health, not just treat conditions. We focus on the prevention of illness and disease. Most of our job is designed in such a way that we're trying to put ourselves out of a job. Unfortunately, we don't see an end to that anytime soon, so we're okay. When we do health education right, we reduce the cost of premature death and disability, and we reduce the financial and human costs of medical treatment. If we invest a little bit of money into prevention, that can save hundreds of dollars in treatment, or thousands, or hundreds of thousands. Health education is very important. So what does the program consist of? Well, the Bachelor of Science in Health is a 120-hour undergraduate degree that prepares students to enter the workforce as that health education specialist I just told you about. Now, next year, we're going to be transitioning, or in about 2 years, rather, to a Bachelor of Science in Public and Global Health. So look forward to hearing more about that in the coming years. But for now, our health program is here. It is sound. It is aligned to national standards. Students who go through the BS in Health at UTRGV are eligible to sit for the Certified Health Education Specialist exam, which is offered by the National Commission for Health Education Credentialing. And this is an optional certification, but students who opt to do this, they show they have a keen understanding of what it takes to be a health education specialist. And if they maintain that certification, they stay up to date in terms of the latest content, knowledge, and material. They know how to do their job and do it well, and we reinforce that throughout the training that they receive in our program. So, what type of courses will you be taking, or will your students be taking? This is just a sample of some of the coursework we have. You start off with 2 classes, Introduction to Health Education and Personal Health. We give you an intro to the process of health education, and we make sure you understand health at a personal level and how your health impacts others and how others impact you. Then we've got a class on Latino health because we're in the Rio Grande Valley. And we call it Latino health, not to say, well, it's not Hispanic or Mexican. As the broadest sense of the term, when we talk about Latinos, that's where we work, live, and breathe. So we've got a course dedicated just to that. We've got a class on health behavior theory. This is an interesting course where you learn all about the different ways that we interact and the theory behind human behavior and how we can change it. We have a class on environmental health, health communication. This is so critical today. I mean, just think about some of the health things you've seen on social media. And if you're not on social media, you've seen it on the news. There's a lot of crazy stuff out there. How do we decipher it? We've got a class for that. Human disease. We talk about community health methods, health program planning, and evaluation. We've got organization of the health program. This is an administration class. How do you administer health programs, do the budgeting and write grants and things like that? And we cap it off with a health education internship where students take everything that they learned in the program and have to apply it in a real life setting, working with real people. So with that in mind, you're wondering, what do I have to do to get into the program? Well, right now we have no entrance requirements. You just have to apply to UTRGV, get admitted, and declare health as your major. And you're going to get into a program that is very fulfilling, but it's a little intense. There's a lot of writing and a lot of research because health educators, we have to know how to decipher the professional literature. We have to know how to read data from government websites and interpret it in a way so that we can share that information in a way that makes sense with the community. So there's a lot of writing and research in our program. Now, these are my tips for success. These are what our middle school and high school students, these are things they should be doing throughout their careers before they get to university. They need to excel. That means they've got to get A's and B's, preferably A's, in both the traditional and social sciences. A good health education specialist has to have an understanding of biology, chemistry, microbiology, anatomy, and physiology. So any chance you get to improve your science and your understanding, do it. But get good grades. We also study human behavior. So we're talking sociology, psychology, anthropology. And I know there's not a lot of high schools that offer these courses, but when you are taking history, you are learning concepts related to sociology and anthropology, not just facts. So every class that you take in high school is preparing you to become a health educator, believe it or not. Our students also need to learn to create, edit, and apply technology in every field that they encounter. And I'm not just talking about, okay, putting together a PowerPoint presentation. I'm talking about learning how an app can be used to improve health and well-being. I'm talking about having an understanding of how computers work, how social network systems work. Today's health education specialist has to have a good grasp of technology because we use it a lot to educate others. So what should you do in high school to get ready for this program? Really, you need to read, read, read. Develop a love for reading. Learn to critically analyze reading. If you're reading something and you're like, what does that mean? Don't be afraid to go look it up. I mean, if you're reading an ebook, open your browser and Google something you don't understand, but read. Also, you need to work on your writing. You need to learn to write clear, coherent sentences and paragraphs and essays, because a lot of what health education specialists do is communicate through writing, either through advertising, writing grants, writing program evaluations, or working with clientele. In any form, you've got to be able to write. So you need to write, and revise, and learn to accept criticism. We're all not as gifted as some of the most famous writers in the world. And even then, even those authors, someone read their work, revised, gave suggestions. Be open to that, but do a lot of that. Also, I would suggest that you volunteer. I know it's a little hard in the COVID-19 era, but there's different things you can do to get some experience working with diverse groups of people. Health education specialists work with a lot of different people. I'll remember one time I was in graduate school. I was the advisor to our undergraduate student club, and we had a presentation supposed to be at this facility. We're supposed to be presenting to a group of at-risk teens and youth to talk to them about nutrition and healthy eating. Well, we got there and they weren't ready for us. There was a miscommunication and that group wasn't meeting. But I had a team of health education undergraduate students there ready to go. So the site supervisor said, you know, I've got another group you can present to. We walked into a room and we presented to a room full of ex-cons who were all out on parole, who were there because the court said they had to be there. So we had to take our presentation, adapt it on the fly, and prepare and give a presentation to a group of ex-cons. And we did it. And we knocked it out of the park. It was a great presentation. They invited us back. But with that in mind, You also need to develop a passion for helping and teaching others. You have to learn to love what you do. And if you love it, you'll keep doing it. If you would like some more information about our program, and I'm kind of blocking myself up here in the corner, I'll move myself out of the way. You can contact the Health and Human Performance Department offices in Edinburgh or Brownsville by email, hhp@utrgv.edu, or by phone. If you have any questions, send me a note or just email HHP. The message will get to me as well. Thank you for your time, and I hope you learned a little bit of something. Thank you.